My husband has a beard. And I just kept thinking, I was like, I don't want to not be able to touch his face, I love doing this with his beard. And I was just like, I want to be able to keep touching his face. Hi, my name is Melanie. I live in New Smyrna Beach, Florida, and I was diagnosed with nasal squamous cell carcinoma while I was pregnant. I was 30 weeks pregnant when I was diagnosed, and basically had a tumor growing in my left nasal cavity that extended up into my eye orbit. I have a now 1-year-old daughter, and I enjoy reading. My pregnancy started out very normally, but at around month 2, I started getting nosebleeds. I've never had nosebleeds before, but when you look it up, it was just all a symptom of pregnancy. They said that nosebleeds are common in pregnancy, so I didn't think anything of it. About 2 months after the nosebleeds, I started just having some sinus pressure. I even said to my husband at one point, it felt like there was a golf ball in my face, but I, again, just chalked it up to pregnancy because I had never been a sinus sufferer, and sinus issues are also common in pregnancy. So waited a couple more months, and finally it just got to the point where the left side of my face, I could breathe perfectly well out of the right side, but I could not breathe well at all out of the left side of my face. There was no pain, no, anything like that, just a lot of pressure and fullness that I kept chalking up to sinus issues. Eventually, though, my left eye started to kind of protrude, and that was when we decided to go ahead and go to an ENT. I was 30 weeks pregnant at this point. We had decided to continue to wait because I just thought, I'm pregnant. They're going to be, whatever they give me, I'm not going to be able to take, because usually you can't take a lot of sinus stuff. And so we just kept waiting. I was going to just kind of power through it, thinking that once I gave birth, the symptoms would go away. But with the eye protrusion, I was like, that's not normal. So we went to an ENT, and this sweet man, he's just kind of a generic ENT, but he scoped my nose, or tried to, and basically could not get the scope up my left nostril at all. He said, there's a he was very, very sweet, just said, I don't see this. He said, I treat sinusitis and, things like that. He said, but you have a mass in your nose, and I can't even see how large it is because I can't get the scope up there. And he said, you need to go and check yourself into an emergency room because you can't wait on this. First, they were thinking maybe it was just a hormonal growth tumor. That would have been nice. But ultimately, I ended up having a biopsy while I was there that weekend at the hospital. I had my first MRI and went and did the biopsy, and it came back as cancerous squamous cell carcinoma. So basically, it was just a whirlwind. I had been having symptoms kind of slowly, and then boom, I have a mass in my face, and then 3 days later, I was diagnosed with cancer. It had kind of been hard to connect to my pregnancy because of all the symptoms I was having, the sinus pressure, all of that. I was excited to be pregnant, but I just, I wasn't a very comfortable pregnant person, and so it had been kind of hard to connect. So I didn't have a lot of pictures of me pregnant with my husband, and so we ended up taking maternity photos in the hospital room. I mean, not even great maternity photos, but so we take those, and we're still hopeful. We're trying to make the best of it. And then we get the diagnosis, and that it is positive and it's cancer. And I just, like, my first thought, we were sitting in the bed. He was sitting in the hospital bed next to me, and my husband has a beard. And I just kept thinking, I was like, I don't want to not be able to touch his face, I love doing this with his beard. And I was just like, I want to be able to keep touching his face. The things that go through your mind are like, I've got cancer. Am I going to make it? That's the first thought that crossed my mind. And then I thought, I don't want someone else, raising my child. I want to be here to raise her. So it was just all of those thoughts. And those first few days were pretty dark. Mine was very large and very intricate, and had also started going up into my dura. So it wasn't going into my brain. It hadn't touched my brain yet, but was invading my dura, which is the brain lining. And so they wanted to act quickly. So he said, you have some time to research it. I would talk to this doctor in Miami, and basically it was like, you can leave this hospital, take a week, to kind of get things figured out, and then move forward from there. So we left there, came home for a few days, reached out to this doctor in Miami. He looks at all my scans, and said surgery is not an option at that point because of how large and intrusive it was into my sinus cavities. He said, you need chemotherapy first, and basically do chemotherapy wherever you have your community. So we decided to go ahead and deliver her first. And so we were home for maybe a week. We checked in at that point to the hospital. So we had wanted to have a natural birth in a birthing center. That had to change. And looking back now, that may have been a good thing as well, because at first I was really, really upset because I wanted to deliver naturally and without, medical intervention, without medicine. But obviously inducing her, I immediately assumed they were going to make me do a C-section, and they did not. They actually preferred that I deliver vaginally, because it would be better for me starting chemo to not have just had surgery. Then all of a sudden she stops. She's like, I think I feel a cord. I'm going to go get the OB. And so the OB comes in, and immediately the tone of the room changes. She doesn't let me sit up. She had me laying down. I was not allowed to sit up. Nurses come rushing in. NICU comes rushing in. And she was wonderful because people kept coming in and out of the room. And my husband and I are just trying to process the fact that we are now going to be having an emergency C-section. Then within 10 minutes, we were back in a room, and she was here. Up until that point, we didn't know she was a girl. We honestly thought that she was a boy based on what we thought our ultrasound tech let slip. And so when they told us she was a girl, that was the best surprise out of everything that happened. Saw her, got to hold her, do skin to skin for a day or so. And then I immediately started chemo there in the hospital, so that I could be with her. My chemo was a 5-day chemo plan. I was on chemo for 5 days. Then I go off of it for, it's a total of 3 weeks until I start the next round. But I was on it for 5 days there in the hospital. Luckily, the chemo did work. Within that first session there in the hospital, I went from not being able to breathe to being able to breathe. It shrunk the tumor that much within my first round of chemo. And ultimately, after all my rounds of chemo, I did a total of 4 chemo sessions, and by the end of that, the tumor that was in my sinus cavity had completely shrunk away. So that was great. Unfortunately, it did not shrink the tumor that had extended into my eye orbit. That barely shrunk at all. Chemo needs blood flow. Chemo works through, blood flow, and there's not a lot of blood flow to your eye orbit, I guess. And so that tumor that was remaining was in my eye orbit, wrapped around my optical nerve or my optic nerve. And the plan originally was chemo followed by proton radiation. That was originally going to be the plan. However, because the tumor didn't shrink enough, there were not enough clear margins to get radiation without hurting and damaging my eye. And we loved our radiation doctor. Then he basically says, you need to have surgery before we start radiation to remove your eye and the mass that's there, because we do not have clear margins. And if we were to do the radiation first, it's going to burn up your eyeball, basically, make it very, very painful. And then you're going to lose your eye anyways because of the damage it's going to do. And then it's going to make surgery a lot harder. Plus, they can't guarantee, right, that the radiation is going to completely shrink the tumor. The only way to completely guarantee that is to do the surgery, remove the tumor, and then radiate the space after that to get any part, any microscopic cancer that might get left behind. My eyeball itself is fine. I don't have cancer of the eye. I have nasal cancer that's extended into the orbit. And because it's wrapped around that optic nerve, and it's like wrapped around the optic nerve and like all intertwined with the muscle that's in my eye orbit. And so they have to remove everything. They can't just remove the eyeball. They have to remove the muscle, the orbit. They removed a lot of structure up into here, bone, as well as, because they were going to do the surgery, there was still some area where the dura was affected. So I actually the surgery I ended up having was, it's called an orbital exenteration, but I also had a crani something. They opened my skull here, and then removed the part of the dura that had been affected. Or not the dura itself, but the part of the bone where it was extending into the dura. They removed that and removed my left eye. I can show you kind of what is left right now. The first surgery was a flap surgery where they took skin from my arm as well as an artery, because you have to have blood flow to the flap. So this is kind of what it looks like. And this bulge, it continues down here. But there has to be blood flow to the flap. And so they take an artery with the skin and kind of trace it up through your face to that skin flap that they've added there to protect everything that they have now removed. Because they have to add bulk back in because they removed so much bulk to get the tumor. And so that was my first surgery. That surgery was much smaller than what I have currently, because I ended up needing to have a second surgery after radiation. When they took the tumor out, it just came back as the same, that it was diagnosed squamous cell carcinoma, P16 positive, and HPV related. Based on what they both saw in the report, they changed the radiation plan from proton radiation to regular radiation, I guess. It was going to be a combo, regular radiation first, combined with chemo, followed up with proton radiation for 2 weeks at the end of my radiation course. My radiation was 8 weeks total. And they also decided to radiate my neck. So they radiated my face with a large focus here because this was where the tumor had stayed. And then they did radiate my neck, even though I did not have any lymph nodes that were saying cancer. They didn't check them all. And so they did radiation to kind of just make sure that if there was cancer in my lymph nodes moving down my neck, that those were taken care of. Looking back, I don't know if I would have chosen to take the risk of the neck radiation, because radiation wrecked me. Chemo, my original chemo, I thought radiation was going to be easier than chemo when I was thinking about the two. I figured it was going to be the chemo that had me throwing up all the time, doing, not being able to get out of bed. My chemo initially was actually, my largest side effects was mouth sores. And so it made eating hard. Food tasted like, nothing. It tasted like dirt, but I didn't throw up once. I had one night where I woke up like really dizzy, but that was it. Otherwise my chemo was pretty easy, and I don't want to say easy, but it was a walk in the park compared to what came with the radiation. 2 weeks into radiation, I couldn't keep anything down. I couldn't eat anything. I finally had to switch to like just drinking. I was on basically an all fluid diet. We got close to trying to possibly put a feeding tube in. Thankfully, I avoided that. But I did lose a ton of weight, and was just doing what I could to get down, boost basically. And I was in bed all the time. Just, it was rough. Those were the darker days of my cancer journey and treatment journey. So right now I am receiving care to kind of continue help healing my surgical site. I'm doing hyperbaric oxygen therapy to make that skin healthier, because it helps regenerate your skin so that when they have to do another surgery, hopefully the skin will be healed enough that it won't create another hole. I'm also seeing my oncologist every 3 months or so. I have another PET scan coming up in about 2 months. My last one, though, showed no signs of cancer, which is great, but we are monitoring it pretty regularly, at least for this first year. And then we will reevaluate after that. It has been a emotional journey. Just it's hard to put into words exactly how that journey has been. But after my first surgery with chemo, I was like really hopeful. I was, going to chemo, talking to the other patients, being positive, like it's going to be okay. And I'm still able to be here and hold my baby, and I'm watching her grow. She was there. I was literally holding her in my arms while my husband shaved my head. Not something you expect to do as a new mother. I also did not get the opportunity to breastfeed, which is something I had been looking forward to and something we really wanted for her. So I had been worried about missing out on that connection, but honestly, going through treatment, I'm very grateful I wasn't breastfeeding. I mean, I couldn't breastfeed. You can't breastfeed when you're on chemo. But going through treatment, I'm just grateful that I wasn't having to do that, because it meant that my husband could give her bottles. He got up with her in the night, which is also not what we expected our situation to look like. He was going to be working. I was going to be staying home. Thankfully, his work was so supportive and wonderful. He was able to take a couple months off and help he helped throughout, but very much so in the beginning. He got up with her at night. He fed her night feedings. I was able to sleep and rest and let my body recover from the chemo. And that was really nice. But it also just, I'm sure motherhood looks different for everyone. You know, they plan on motherhood looking one way, and whether they have cancer or not, it looks another way. But adding in the cancer component to motherhood, just there's always a fear there. Every moment though is so much sweeter, because in my mind I was like, I wasn't sure I was going to get these moments. Mental health, in my mind, is almost more important than the physical help you're getting with treatment. You have to take care of your mental health, because otherwise cancer will crush you. And once I started getting help with that, I started seeing the therapist through the hospital that I've always gone to therapy. I had a wonderful therapist who helped with general life things, but I could tell she was a little uncomfortable with some of the medical, cancer just is it's very different than just regular life things I would go and talk to her about. So I started meeting with the therapist through the hospital, which is free. Your hospital should provide a therapist. And so I started talking with her. I did 1 or 2 head and neck cancer support groups, but one, it's hard for me to do those because of needing someone to watch her. But I also I'm like 30 years younger than everyone in the group. Head and neck cancer, at least what I have, is not common in younger people. My odds were like 2% of this happening. And so I was able to connect with them from like the head and neck cancer perspective, but not from being a new mom, navigating, complete facial changes and radiation while you're trying to raise a baby. But yeah, mental health, taking care of your mental health during cancer is important. Very, very important, because it affects everyone around you. I would want is for really anyone, but especially any new mom going through cancer and or any medical diagnosis, it will get better. It is a struggle and a fight, and it's life-changing. I know that life will never be the same, but you will find a new normal, and there will be happiness in that. It can be so hard to see that when the days are just nothing but dark, but there will be happiness. And the day before that might suck, but the next day can be a happy day. And the next moment can be a happy moment. The side effects continue. Your body is different. For me, I know that's a little bit more physically aware. Like my body will never look the same, but your body never feels the same either. And I'm working on gaining my strength back. I still need to put on weight. I need to go back to strength training, but my body is always going to be different. It's been put through the ringer, and is, forever altered, but you can also get your strength back. But you just need to be mindful that because cancer is now a part of your story, it's always going to be a part of your story. It's always going to be a part of who you are now, unfortunately. And you just have to define what that's going to look like for you, and whether you're going to let it be a negative thing or whether you're going to let it be a growth thing, something you learn from and help, whether you use that to help others, who are going through it, whether you use that just to kind of strengthen yourself. If you can use it and turn it into not a positive thing, because I never, in my mind, cancer is not I would never wish it on anyone. I don't think anyone needs to learn from it, but you can learn from it. And if you can turn that into something positive, then that's better than letting it just define who you are as cancer.